important topic.
Thank you, sir. Thank you, Chairperson. Today I will be talking about the importance of counseling. As sir has already highlighted the importance of counseling to be done. What is counseling? Counseling is a specialized, it is a non-clinical activity that involves giving information, explanation, guidance, and providing comfort to the patient. Counseling helps in providing verbal information, explanation about their disease, guiding them in making decisions with regard to various treatment options available. Objectives of counseling are reduce workload to the doctors and MLOPs, ensuring patient satisfaction and compliance, increasing patient volume. Ideal model for counseling is moderate educated female from rural area are the best suitable candidates in a high volume community based high hospitals. Candidates who successfully complete a 2 years training course are also appointed as counselors, and to my knowledge doctors are the best counselors. The various roles of a patient counselors is a guide, companion, information giver, facilitator, help in decision making, negotiator, supporter, comfort, link between a doctor and a patient, between the families. Quality of a good patient counselor is that the bright and pleasant look, willingness to serve old and visually handicapped patients, clarity of thoughts, simple and clear communication of information to the patients, compassion and kindness regarding patients and patient care, basic knowledge in ophthalmology and sympathy towards patients. So these have the qualities that has to be inculcated in them. Then the type of counseling, you come to it is a individual counseling, it is a group counseling and the family counseling. Advantage of individual counseling is counselor is individually sitting with the patient and doing the counseling with the patient or the relatives. Personal attention is there, patient feels free to talk because patient alone is in the room along with the counselor. Patient's acceptance level is very high. Sometimes patient they have apprehension in their mind and they may not open up in the fora or in many people. So in one-to-one counseling they can open up and they can ask their queries. So patient satisfaction level is high. Advantage of a group counseling means suppose some sort of a post-operative information we want to give to patients and it is common to everyone, then we gather the patients and then in group we do counseling. So that is known as a group counseling. Shy patient is motivated to interact in such group counselings. Direct dialogue may be there. Then patient fear psychosis is reduced. A member of group who has not understood that the counselor has said can clarify doubts from another member. Now suppose some counselor says something and the patient is not able to understand, but patient can ask to other patient who is there in the room. So the patient can reciprocate what has been told by the counselor. Now family counseling means there are two parts, some genetic counseling and grief counseling. Genetic counseling is done in certain cases like retinitis pigmentosa, then RP, retinitis, these retinoblastoma cases and all. So this genetic counseling is there done for the consanguinity, consanguine marriages and all other problems they can crop up. Then the grief counseling, suppose if patient develops some infection or some problem post-operatively or sudden death in the hospital, so that is a grief sort of a counseling that has to be done to the patients and meticulously to understand the patient's problem and psychology. The art of counseling is different, body language, listening, voice modulations and all important. Body language, frequently the counselor has to be cool, calm, the direct eye-to-eye contact. When you are counseling, you should not look at the mobile or see somewhere and do counseling. You should have direct eye-to-eye contact, relax body postures and friendly gesture. Then listening, two aspects, hearing and understanding. So listening is also very important in counseling. What patient says, the counselor has to listen. Then the good characteristics of a good listener. So these are the carries out the appropriate need and wishes, expresses word of sympathy and shows respect and interest. Then the voice modulation, depending on the situation, the counselor should modulate her or his voice according to the an appropriate body language with the patient. Then barriers of communication are misinterpretation. Patient have a wrong notion of laser is a dangerous procedure or some myths they are there in patient's mind. Then the age and uneducated patients, aged patients may not be interested in details. Language problems sometimes. Then patients may interrupt during the course of the counseling and distractions, some phone calls or some talks, something like that. Then overcoming the barriers, what to inform. So these are the various ways how we can overcome the barrier by estimating cause, post-operative guidelines, detail about the causes of the diseases. Now certain analogies are also used in counseling, like Some examples are given like traveling by train and traveling by a flight analogy. Patient may ask which type of lens, what is the difference between this lens and that lens. So some sort of the analogy can be used, or walking stick analogy. Then the tips of the good counselor: be relaxed, attentive, learn forward while talking, keep facial expressions, look pleasant and genuine. Setting up of a counseling room, a room has to be there, quiet and peaceful. Chair, table should be there, computer, sufficient distance between the patient and the counselor. So various counselor aids are there. They are the models which we can do counseling: laptops, booklets and albums. So counseling in community, I think the time is up, so I will not go in more details about it. So coming back to the main carry home message in counseling is very important part, integral part of our treatment. If you can see patients, you can diagnose diseases, you do surgeries, but if you're poor in counseling, again the services, you may distract you, or the patient may not get satisfaction. So in order to have a direct dialogue with the patient, pre-operative, some myths are there in patient's mind, post-operatively something has to follow, and the outcome of surgery is suppose not predictive. So this counseling really helps and clears the doubts between the patients and the doctors. Thank you very much.
Thank you, doctor. Yes. The most important part is that we cannot rely on the counselor itself, because sometimes doctor is the best counselor and patient usually believes on the doctor.
Yes.
So this is the most important part. Another part is that if everything goes all right, that's all right. But if something goes wrong, then only the problem comes. That's why we have to be prepared that everything should be counseled properly.
Yes. Thank you, sir. Thank you very much.
So we are welcoming Dr. Alaka Jha here, co-chairman.